In this video, we'll be using the standard vaccination technique, which is intramuscular injection into the deltoid muscle. This technique is used when injecting almost all vaccines from childhood onward. We'll be referring to the recommendations of the Centers for Disease Control and Prevention. You'll need the following: disinfectant, disposable gloves, sharps container, cotton swabs, vaccine, bandages, and possibly a syringe and needle. Vaccinate the patient's non-dominant arm, for example, into the left deltoid muscle of a right-handed patient. Palpate for the most muscular part of the deltoid, typically located about 3 fingers inferior to the acromion. Disinfect the selected area. The injection site should be completely dry before injection. Put on gloves while waiting for the site to dry. Remove the cap and expel larger air bubbles from the syringe. Small amounts of residual air do not pose a risk to the patient. Hold the deltoid muscle with your non-dominant hand without lifting the subcutaneous tissue. Hold the syringe between thumb and forefinger roughly like a dart. Encourage the patient to distract themselves from the pain by coughing or holding their breath. Quickly pierce the skin perpendicular to the surface. The standard puncture depth is about 2 centimeters, or 3/4 of an inch, but this should be adapted to the thickness of adipose tissue. Aspiration before injection is no longer considered necessary, so quickly inject the syringe content. Remove the needle and dispose of it by dropping it into